we're going to go next to Dr. Noel Jacobs from Oklahoma.
Terrific. Hello, everybody. Thanks for doing this tonight. And coming after the PAC members, you three are amazing. And what you've covered and described in your own life and how you're coping is exactly what I will be talking about. So I'm going to go through this briefly and put some of the things that come from our training up to just have for discussion. But I think that the community has learned a very important piece just by hearing your own stories. All right, Christian, if you don't mind forwarding. So we know that our lives are disrupted right now. We see this in just about every area, depending on where we are and our developmental level. Most of us, even if we are not with our families right now, we know that their lives are disrupted as well. More and more people are working from home. Some people are having their economic life disrupted, which causes a different kind of stress financially for them. But we see change no matter what. And of course, now I'm the one with a barking dog. So this leads to differences in the way our daily lives are going to have to go if you want to keep moving forward with that. That's great. Social life. One of the things that I heard from PAC members, you may have already gotten used to the need for some levels of social distancing because you're immune compromised, because of the treatments that you're going through, et cetera. But this still presents a new set of possible anxiety provokers, which is that you can't, even if you choose to, in certain circumstances, we're supposed to be with our families only. Maybe you're stuck in a dorm room with a roommate, but that's your entire physical social circle now. We also have uncertainty over what's going on in our lives and how this is going to continue and resolve, maybe resolve in layers. There is such a thing as virus anxiety by itself, which means it's unknown, we can't see it. Is it around me? And I know some of my own patients who already deal with anxiety can have an extra layer of this right now. So these are the things that are affecting all of us. And of course, that means that IBD patients and their families are going to be dealing with this as well. Case in point, the stories that we've just heard. All right, go ahead. So your life might have looked like this. One of the balls in the air that is not represented is, thanks, Shazad, is living with your health condition and the things that it requires of you to do to keep your health and your physical wellness going. So these are the things, though, that we tended to have in our life in a certain way before the virus happened. Okay, go ahead. So we've lost some of the structure that we had before. Maybe we don't have a wake-up time anymore. I'll tell you, at the hospital, we have slowly switched over to virtual care, but there have been many mornings when my world doesn't really start until 9 a.m. and it used to start at 7 a.m. So we have a little less structure in our daily life. We can't maintain the frequency and type of different levels of social contact that we had before. And as I said before, especially if we're living with family members, our family members are going through their own stressors. Sometimes I like to say that my patients, my pediatric patients, are like tuning forks. Without their parents fighting in front of them or showing or talking about stressful things like finances and work, et cetera, kids pick up on it. I say that they're like tuning forks. Parents also, because they may feel like they have more things to think about that are necessary in their daily life, they may actually miss some of their child's stress. So it's important to know that these things may be coming up in all of our lives, and sometimes some of these stressors are present and others aren't. And on another day, the stress set that we're dealing with is different. Okay. So I will tell you, I have two teenagers. I have seen this very image recently. A teen who has had a phone for most of the day that really is just sort of cratering at the moment. And I think this is what many of my patients are doing with the virtual visits that I've had. I have heard about this and I'm sometimes seeing it myself. Okay. Next, there we go. All right, so one of the things I want to say is self-isolation looks different for everyone. PAC members have already mentioned you might have been living with some level of self-isolation already. The research on introversion versus extroversion, and by the way, this is going around like wildfire right now as we're dealing with coronavirus. The hard research on it has pretty much been debunked, but there is a flow to us, and we tend to be introverted sometimes, extroverted sometimes, and we tend to function best when we can go back and forth with that based on the need. Having said that, I know many people, I am one of them included, who sees themselves as primarily people-oriented. I get energy from my time with people, and this has been killing me. I love the 3 people in my family in my house with me right now, but I have tended to have a bigger social circle than that. So I have struggled a bit only being able to see my friends over Zoom. I have a teenager in the house who is used to social distancing by personality style on average days. And they are absolutely in heaven right now because they're getting all the kinds of social contact that mean the most to them. And any physical contact that they need face-to-face, they're getting it enough from me and my family. So it's the direction and intensity of change right now that may be bothering somebody. And you may feel fine on one day and on the next really feel isolated and alone. So what we need to do right now is find a new temporary normal. Okay. So general recommendations for self-care. Make sure that you're getting good sleep. I can't stress this enough. Our sleep schedules are almost all a little bit different than they were, but finding a way to go to bed at a decent hour and get up around the same time every day actually helps with mood. It helps with medical functioning and immune stress. It helps with your body's overall energy level. And you might find it's easier to cope right now if you're actually getting better sleep. That includes putting that phone away an hour before you want to fall asleep. So make sure that the time is set for that so that you can do it well. Provide some structure to your day. Take intermittent breaks and do social check-ins, but also do some work that is helping you move forward. If you're in school and you should be doing schoolwork, find some time structure. We have schoolwork going on. It's a whole lot less than it was when our children were in school, but there's still some work to be done, and it actually helps. And we have found that mood is better when students, that's your job during these years. When you're doing some structured learning, your mood will actually likely be better because you do feel at some level like you're moving forward. Get some time outside when the weather's good. We have actually had thunderstorm and tornado watches today in Oklahoma. Not a great day to be outside, so we did some inside exercise, but some structured time outside when weather bears it, and some regular exercise. I think Kat just put up yoga. An important thing, and you'll find good inner energy and some good outer energy, including some mood help from that. All right, healthy eating and drinking. Please don't let sitting more during the day now lead to eating more on the couch, especially the unhealthy foods that we tend to eat. There are terrific ways to have snacks through the day based on what your diet allows and based on what is generally good and healthy for everyone. So make sure that you're doing that. Make sure that you're keeping up with water drinking that you need. Limit your time on news. A whole lot of the news is negative right now, whether it's political talk or virus talk or economic talk. It can actually be stressful. So maybe do a couple of check-ins a day, one in the morning, one in the evening, not too close to bedtime, by the way, but make sure that you're limiting how much time you have on news. And then pampering and enjoyment. It is important to find some time every day to do something good for yourself. A lot of the things that you can do for yourself are free. One of the things that we do are neck and shoulder massages, and it's de-stressing, it's physical contact, and it actually helps us through this time if you can do that. So do some things that you enjoy every day. All right. So mild difficulties, and I put an asterisk here because if you're dealing with significant levels of any of these, there are online telehealth visits that you can schedule, usually through your own healthcare facility. And there are likely mental health resources if you're in college on a campus. There are college resources that are switching over to virtual care now. And there are places where you can get virtual help. There is great research that says good counselors providing virtual care are doing just as good a job as in-office visits. So don't let the idea that you're going to be physically distanced from your therapist, keep you from engaging in therapy if you need it. For mild difficulties, anxiety, whether it's virus related or general, what we call free-floating anxiety, try to see if there is a source of that anxiety that you can pinpoint and identify. Discuss it with people around you, whether it's peers or family members or professionals, and then look at ways that you can help yourself with that anxiety, whether it's physical exercise, muscle relaxation, breathing, etc., or it's cognitive exercise, identifying and challenging the assumptions that you might be making that you can challenge and realize you don't have to worry as much as you're worrying. For sadness and loneliness, there's great research out there about exercise. We call it behavioral activation. Exercise actually is known to help reduce depression as much as medication is. So it's important to know that. Plan social time. Challenge yourself and challenge the thoughts that you're facing that are leading you to feel lonely or feel more sad, when you can undermine the thoughts that are not helpful thoughts and are not grounded in rational life around you. Anger. I know I heard a little bit from one of our PAC members about getting angry inside the home with family. We're all going to do that because we are spending more time together, and we will trip over each other, and we will get a little bit tired maybe of each other's faces sometimes. Try to identify the source. A lot of times it's in us. It's our own stress and frustration. Pause, breathe, use a sense of humor. With relational conflict, again, try to identify if there's a specific thing about the conflict that can be worked through with compromise. Try to separate the person from the issue that you're having. Take breaks from each other. We do have go to our corner time in our family. We go to all different rooms in the house, and that does help us with a little bit of solitude. We can face each other a little bit better when we're back together. Take breaks, create plans about how to spend time as a family. I don't want to take too long. Just remember getting variety in your day, some structure, getting outside, taking breaks, and then planfully and willfully working through some of the things that we deal with each other can help you through this time. Thanks. I think I've spoken enough.